Hi, this is Dr. Lifton from Brainsplained. I wanted to talk about it could be worse. So patients either do well or they don't do well, and they either have a really bad disease or they don't have a bad disease. And although those two things should correlate well, it's not necessarily the case. And it could be worse is one of the most important key things I'll hear from patients who are going to do well. And I've thought a lot about what that is. It's kind of complicated. My first experience with it, I was just a resident. It was back in Rochester. We had a patient on the medicine service. We were consulted. He came in with a new onset quadriparesis, and he had a very obvious spinal cord issue, so we took a MRI of it, and he had a massive destructive bony lesion. His C7 vertebrae had just disintegrated, and he had compressed his spinal cord. He had a sudden onset of complete paralysis. And then we pan-CT'd him, which is a CT chest, abdomen, pelvis, and he had metastatic lung cancer all over the place. He had a bunch of lesions, and I think we biopsied one in his liver, and I'm not sure. We biopsied a lesion somewhere, but it was all over, and it had spread to his spinal cord. And so I was taking care of him for his being paralyzed, and because that's the way he presented. The cancer doctors weren't going to give him anything. It was like, you should have hospice. And for the spinal cord lesion, they couldn't really radiate that, although he had other lesions. He had other spots in the spinal cord that they could radiate. So it's, I don't know, day 5 or day 6, he's in the hospital. This is before insurance was like it is now. We would have people in the hospital for weeks. And I walk in, I say, "How you doing, Mr. Jones?" And he said, "Oh, I'm great, doc." And I thought, oh no, they've upped his morphine too high and he's got confusion. So I went over his issues. I said, you're paralyzed and spinal cord injury and, never walk again and incontinence. And he said, "Oh, no, I know all that, but I'm good. It could be worse." And I got like, "What?" And he said, no, it's great. Actually, it's good. My wife said I can smoke. He was a heavy smoker, 3 packs a day. And she means it. She doesn't, because I'm dying, she doesn't care anymore. And, we're lucky because my son is paraplegic. He had a spinal cord injury. So we know about it. We know how to set it up. Some people don't know. It could be worse. And over the subsequent, for the next 30 years, I've had patients tell me it could be worse. And the patients have had a stroke and they're paralyzed, and it could be worse. I have spinal cord injury patients, they are wheelchair bound, and they tell me, it could be worse. I've had ALS patients tell me it could be worse. Some of the Alzheimer's patients tell me it could be worse. Parkinson's patients do it. It doesn't matter what the disease is. And it's a shortcut, right? It's a shortcut. It could be worse is a formula that comes out of a practice of gratitude and being grateful. Oh, I'm so happy I have this, isn't really quite exactly enough. I mean, some people think it is. They think that's gratitude. There's an old Sufi story, and I forgot the Sufi master, but this man is very upset, and the Sufi guy says, you need to go on this journey, and it's very far. You'll bring all your valuables. It's very important you take all your wealth with you in a bag on this journey, and you'll go see my friend in this faraway town. And the guy goes on the journey, and he gets beaten and robbed. They take his bag full of his valuables, and he's distraught, and he keeps on walking. He figures he might as well continue the trip, and goes further down the road, and his bag is sitting in the middle of the road, and he's overjoyed, and he's so happy. The Sufi master is there. He's the one who robbed him, and he's like, "Why'd you rob me?" And he's like, "It's amazing what you have to do to make some people happy." There's that story about the inability to appreciate something without the process of thinking, what if I lost it? What if that wasn't it? If you don't contemplate the loss, then maybe it's not a whole part of the gratitude. And I think the people who do gratitude like that, the people who do the gratitude where they conceptualize, I could be without this, I could not have, a car, I could not have an eyeball, I could not have a liver. That could have been me. I could have lost my kid. That formula of gratitude is the one that says it could be worse. Because it could be worse is really a shortcut for, yes, I have this. Yes, I have this suffering. Yes, I have this disease. But my gratitude practice allows me to realize that there are many things I still still have that I can hold on to, I'm grateful for. I think that's the attitude that really is the key that makes the difference between when I get an illness, if I can manage it, if I can manage the disease or not, is if I have if I have a powerful enough practice to be able to still think it could be worse. Anyway, it could be worse. I hope that's brain-explained. And I'll see you next Friday.